So my name is, okay, so the recording started. So today I want to talk about preventing falls in people with dementia and what can we do together. And I'm Yuanjin Zhou. I'm a PhD candidate from School of Social Work at the University of Washington in Seattle. So a little bit about me. I'm a first generation immigrant from China. I studied my bachelor and master degree in social work in China, where I started to worked with people with memory loss and their families. And then I come to the US and to continue this study. So what I want to share with you today is my perspective on fall prevention for people living with dementia, which might be impacted by my culture, by my age. So actually you can be super critical about anything I said today, and I'll be thrilled to discuss with you. And also I want to talk about what I learned from existing scientific studies and what care partners of people living with memory loss shared with me. So I haven't had the chance to talk with people with memory loss about their experiences of fall risk. So I'd like to hear your opinions after the talk if you have any questions or insight you want to share with me. A little bit funding disclosure, because I will talk a little bit about my dissertation, which is funded by the Healthcare Education and Leadership Scholars Fellowship. I'm very excited that social work, education, and National Association of Social Work Foundations are interested into fall risk as well. So, okay, so what is fall? Sometimes I feel I don't need the definition because everyone, we kind of experience falls at some stage of our life. But I think this very academic definition can be helpful as it emphasizes that unexpected events when participants come to rest on the ground or floor or lower level. In my experiences, it means even when you sit in a wheelchair or you sleep on the bed, you might still fall. And this is also happening for people living with dementia. And sometimes we don't know that's what happened. And why I care about these things, and this is from the literature, first is for people living with memory loss, they actually experience higher risk of falling than their age-matched peers. It depends on what kind of diagnosis you have. You might have 2 to 8 times higher risk of falling. This is not well known until like decades ago. So that's why I started to study this. And it's very obvious have negative impacts on people with memory loss because you might have a fracture, you might end up in hospital. And of course, this will bring a negative impact on care partners. When your loved one is in hospital, it's a very stressful experiences. And especially during the COVID-19, we all want to avoid hospitalization as we can. And in general, we don't want to go to hospital. And another reason that why we want to work on fall prevention from a more positive perspective is this is also our strength, that there's a lot of things that we can do, and we have done a lot of things that can contribute to preventing falls. And why don't we just to do those things better or more? And another thing is preventing falls also have other benefits. It can relate to our overall health and well-being, not only for people with memory loss and also their loved ones. And then this is our two positive reasons that we need to learn more about it. But there's a lot of challenges when I think about preventing falls, or what I learned about preventing falls for people living with memory loss is there are limited evidence-based programs for them. One of the reasons is previously dementia or cognitive impairment was an exclusion criteria when people developing fall prevention intervention. But nowadays, there's a lot of scientists started to explore more, but that's also a reason that we don't know much about how we can actually preventing falls for them. And another challenge is just there are so many risk factors of falling. I put the citation here, but I'm not gonna go through one by one. There are so many things to learn. And also this is posed a challenge to us as a caregiver, as people living with memory loss. How am I supposed to deal with all these things in my everyday life? And let alone there's another challenge. It can be a difficult conversation. I actually learned this from Mary, because one day she told me that how difficult it is for adult children to bring up fall risk with their parents. It took her or her friend for 1 year to really go to this conversation. So people sometimes don't want to admit themselves experiencing fall risk. For care partners, sometimes they don't want to admit their loved ones experience fall risk. This their parents, I think their parents are strong. I don't think my parents need any help. They're doing great. And it means a lot of life changes might happen, which is scary for everyone. And also there is a strong stigma of having fall, being old and vulnerable. And those stigmas sometimes become a barrier for us to actually improve our living situation. With all those challenges in my mind, I did a study. So I talked with care partners. I asked them the experiences of living with fall risk, managing the fall risks for their loved ones. I asked them, how do you start a conversation about falls, and what we could do together to prevent the falls? What do you do to prevent falls in your life? The first is how to start this conversation about falls. It starts with observation, not just by caregivers, also by people with memory loss themselves, because they also know their body really well. They know they're in danger, they know they are worried, and they know there's something is wrong with the eyes or the legs. So in the beginning, caregivers and people with memory loss, they start to have those observations. And then sometimes they start to learn those things. Caregivers can attend a balance class. And one case is the people with memory loss actually go online and start look on this information themselves. And those things make it easy for them to discuss about fall in the end. So for some people, the caregiver say you cannot just go and say, oh, I think you are in risk of falling. They're not gonna hear you. It's about, what do you think? What are you worried about falls? What do you think you can do to prevent the falls? Actually, what kind of strategies that you have come up with to make yourself feel safer? And how do you want me to support you? There's a few couples share their experiences of how they have this difficult conversation, and I find it really exciting that people can actually face this all together. And then I asked them, after you realize that there is a fall risk, so what did you do? What do you two do together to managing those things? And those are the themes that people discussed in the interview. And I will go through one by one. First, actually, is the simplest one, but I didn't know this before, which is interesting. They said, oh, I just hold their hand and let them lean on me. I didn't know this is so intuitive, but then I realized how important that is in people's everyday life. And of course, some people say, oh, I want them to use a working aids. And one of the challenges they have is to deal with the stigma. And because people don't want to use it, and they resist not using it. And one of the quotes that I really love from a care partner is, I told my mom, you are the boss. This worker is the tools. It's like you want to draw a picture and you need a pen, and now you want to work, you need a worker. So this is how they want to empower the people with memory loss and to use the tools they have to continue live a very active life. And sometimes they also need to negotiate with the primary care providers, as they might have different views of whether these workers can help them or not. And what if people with memory loss don't like it? My mom never let me to hold her hand, even she's about falling. So what you gonna do? So say some care partners say, yeah, my mom figured out their own way. There are ways she's trying to make it work, and I will help her. Like my mom work by the things, and then I arrange things in a way that she could work safely in the home. And sometimes they accept different people's help. They might don't want you, because especially parents may don't want their kids to help, but maybe they like their friends. maybe they like their partners. So, and they also prefer different type of help. So even mobility is such a simple way to preventing falls. A lot of discussions are happening. A lot of discussions can happen in the family, so can make it easy for people with memory loss to preventing falls when they go out. And another thing is really relevant is a medical management. It's not just about exercise. There are so many other health conditions related to falls, like dehydration, infections, and pains, and medications. I'm not a doctor, but I have know that how important those medical conditions can cause falls. So you can initiate this conversation with the primary care providers. Actually, there's a lot of efforts among the primary care provider trying to learn how to help people living with dementia to prevent their falls. So I think the more you request it, the more the care partners will be prepared to have this conversation. And I think this is, we have heard a lot, exercise and nutrition and mental health. And not surprisingly, they are all can help you prevent the falls. I just want to share some interesting findings I have. Is actually for exercise, what is important is it can be a good opportunity for you to engage other families and friends. I know a lot of primary care partners, they are really exhausted. But maybe it's a good opportunity for you to say, how about another friend to come and help, and how my son and daughter can come in and take you out for exercise. And this is a strategy that I learned from them. And you can also, they also use a lot of activities in their everyday life and exercise that all can enjoy. And a lot of people share the experience with me that how their health plan actually have some exercise support, that can support you to do exercise and they don't know before. So maybe this can something that we can do in your after next time when you meet with your healthcare provider. And for nutrition, one thing that I find is, when care partners are tired, they don't want to cook. And that's a very simple fact. But then it's also another reason for care partners to take care of themselves, because that's the foundation of your house and your partner's house. And another thing that people emphasize a lot is how make them happy is so critical for them to keep safe. Because if they're happier, they will be less depressed and less anxiety, and which we don't, which are critical for risk factors that we don't know how to manage. We don't do much about them. Another aspect of fall prevention is home modification. It is actually really hard to do when there's a lot of planning involved. One thing that caregivers share with me is to start with the small scale changes. Start with now, small with the things that you can do. Actually, those small things can make a difference. And another tools that people use is some assistive technology like GPAs and a fall alert. There is some discussions about maybe some people are not comfortable with technologies, which you need to start as when maybe this can be a topic for you to discuss. And another thing that I find is interesting is when care partners realize there's a fall risk, they start become super worried. They start to stay at home a lot. They don't want to go out with friends. They become more isolated. One care partner say, I cannot even date now because I'm worried about my mom. And those are the things so these are the things that I think is important when we think about fall prevention, is also care partners need to think about how to do self-care and keep social connection. And one of the ways that care partner trying to do is also help seeking. It can from families and friends and from the care workers, and you can use the respite care and support groups and receive training. As a social worker, I find it inspiring to know that there are so many things that care partners are used to make sure themselves and their loved ones can stay safe at home. But I also want to know how we can do better to do this. So this is the strategy that care partners currently use. The impact of those efforts require further examination, which is I'm trying to do in my dissertation. But I also would encourage you to try some of those if you are able. And you might need to observe, does it work for you? Does this really help for me? Because every people also have a very different situation, and you will want different situation. So this is a process of trial and adjustment are really important. And in the end, I want to share this picture. My partner is engineer. That one day I was sharing my talk with him that about fall prevention. And he said the easiest way is just send everyone to the moon, so nobody would fall. I said, okay, yeah, that makes sense, because one of the reasons that we fall is we're living on the earth. But whenever people think about fall, it's always think it's your individual fault. It's your fault. If you're not careful enough, but they never look at the environment that we stay in. So what do we actually want to prevent the falls? We need a more dementia-capable medical care system to deal with the medicine and the impact of dementia. We need to have dementia capable of health promotion policy and services. We need a workplace policy to support caregiving, so all the families can get involved and not only rely on one caregiver. We need housing that is able to adapt for people with dementia's needs. We need support for technology. We need a care network. We need alternative care options. And we also need to destigmatize fall and aging and dementia, so people can talk about it and face it, and have come up with creative ideas to solve them. So there are so many little resources about fall prevention for people living with memory loss. This is our only tool that I have found. So I want to share here with you. And I hope with my efforts and many other, with your support and a lot of healthcare providers support, we will have more resources and programs for people living with memory loss and their care partners. And yeah, so this is what I want to share with you today. And if I welcome any questions or suggestions or critiques. And if you have any experiences, I also would like to hear, what do you think we can make this full conversation easier, and what strategies that you have tried in your life that you want to share with all of us? Thank you.